I believe that the federal government does not need to establish public health care or health insurance for free for all citizens. Um, I know you mentioned that the life expectancy would increase in age if there was free health care and free health insurance for everybody. However, I believe life expectancy also increases based off of other factors. This includes diets. Not all diets need to be monitored, obviously, by a dietitian or healthcare physician, whatever you prefer. Not all body types need to monitor necessarily what they are eating, but there are, for example, certain foods that are proven to help your life expectancy increase, and that has nothing to do with the healthcare or health insurance. Yes, it does make it more accessible for people to get help when needed, which obviously can increase your life expectancy. Let's say, for example, you contract a virus unexpectedly, and obviously you would need that health care to fully recover from something like that, or maybe get extra nutrients that are needed, which in this situation it does increase the life expectancy, but that is not the only thing that can contribute to that. Other things that deal with life expectancy can be smoking, for instance. If you don't smoke cigarettes, let's say, you're less likely to contract something like lung cancer. And so life expectancy actually has multiple factors that contribute to it rather than just healthcare or medicines that you may need. Health insurance is currently implemented in the United States, obviously, to protect you from unexpected high medical costs, which it's kind of taking a risk, obviously, to get the insurance, but once you have it, it is totally worth it because you won't have to deal with those high costs. I know it's unaffordable for a lot of the population, and paying for that type of insurance can actually put people down into the poverty range, as you have mentioned. However, if you are investing in the insurance, you're actually paying less than what you would be paying if you just went to a physician to get your health issues solved. So, let's say, for example, you need to go to the hospital for something. If I paid that out of my pocket, it's going to be thousands of dollars easily. If I'm paying for my insurance, it's probably still, depending on the severity of the situation, but it's probably still about $1,000, if not a little bit more. But it's not, it's the difference between $35,000 versus $3,000. So in the situation that something does happen, it's worth it that you are investing into this insurance because you will need it. And most people do end up having to visit a doctor or a hospital at some point in their life. I'm pretty sure everybody has gotten sick before, or at least just sick enough to the point where they seek a doctor for some sort of medication. And so having this insurance will help with that. And in relation to medications, a lot of them are cheaper if you have insurance. I know personally I have a couple prescriptions, and because of my insurance, I can pick them up for $6, $15. Obviously, it depends on what I'm picking up, but having insurance doesn't include just doctor visits or hospital visits. It also includes medical related things that arise, such as prescriptions. And obviously, there are some people who just completely avoid doctors and don't take any prescriptions or need any medicine. And so, investing in health insurance might not be their best decision because they're probably only going to go to the hospital then, a handful of times in their lifetime rather than a handful of times per every year. You also mentioned that the government should pass a bill for free healthcare for everybody, and I don't think this is a good idea because it is going to cost a lot of money. Your solution to that was to set a budget. Your example was, a $3 million budget that the government can pull to invest into healthcare so that way everybody can access it for free or maybe even just cheaper. But I disagree with this because you also said it would have to raise taxes for us. This could, maybe save money instead of investing into an entire insurance policy or plan. However, if you're raising the taxes, you are still raising payments for the people of the United States. And so we're still paying extra money, and that means that money would be mandatory for everybody to pay, even the people who don't regularly see a doctor or feel the need to go to the hospital in an emergency, because there are people out there that will, fix all of their own issues. So raising the taxes, I feel like, would not be extremely beneficial because you are still paying money, and some people would get upset with that, especially if they're not visiting doctors. Your main example was comparing Canada to the United States with their health care, because Canadians don't pay for a lot of doctor-related things such as regular physician's visits. They don't pay for childbirth and anything along those lines that I guess could be deemed as necessary medical needs. That would be nice in the United States to not have to pay for these things, especially coming from me because I go to the doctor, every other month, so I visit a lot. However, if it was free, I don't believe that the people in that profession would be making a lot of money, which I feel like they deserve the money that they make because they are saving lives in a lot of instances and obviously helping people feel better. And if the government was using a budget to pay the people who maintain these occupations, I don't think they would be making as much money as they do now or as much money as they deserve based off of what they are doing for the people. I do believe that health insurance is beneficial for these visits because you still pay money. However, my doctor visits are $20, which I know for a lot of people, if you're spending that much money consistently, that is a lot. I think this debate is different based off of regular physician's visits versus emergency hospital-related visits because they have two completely different price ranges. However, I stand by the belief that healthcare should be paid for. Insurance plans help you lower these payments so it is more affordable.